everybody. Welcome back to Psychedelics Today. This is your host, Kyle Buller. Today on the show, I am joined by Dr. Hassan Tetteh. Dr. Tetteh is an associate professor of surgery at the Uniformed Services University of Health Sciences, adjunct faculty at Howard University College of Medicine, and currently Dr. Tetteh is a thoracic surgeon or staff surgeon for MedStar Health and WRNMMC, and most recently served as a command surgeon for the National Defense University. A native of Brooklyn, New York, Dr. Tetteh received his bachelor's from State University of New York, SUNY at Plattsburgh, his MD at SUNY Downstate Medical Center, his MPA from Harvard's Kennedy School of Government, MBA from Johns Hopkins University Carey Business School, and MS in National Security Strategy with a concentration in artificial intelligence from the National War College. He completed his thoracic surgery fellowship at the University of Minnesota, an advanced cardiac surgery fellowship at Harvard Medical School Brigham, and Women's Hospital in Boston. Dr. Tetteh is a certified professional in healthcare information and management, board certified in thoracic surgery, general surgery, clinical informatics, and healthcare management, and is a fellow of the American College of Surgeons and fellow of the American College of Healthcare Executives. Very well established and accomplished, obviously, from his bio there. And he is also the author of The Art of Human Care, which is the book that we get into today on the show. And this is a little bit of a different interview. His PR person originally reached out and let us know about Dr. Tetteh's work and mentioned that he experienced a near-death experience, and not just one, I forget, two maybe. And that kind of caught my attention, and just thinking about the interesting conversation that could unfold from just having this these similarities between near-death experiences and psychedelics, and just thinking about the transpersonal aspects there. So that caught my attention, and definitely wanted to chat with Dr. Tetteh about his experience and, our background in transpersonal psychology. So a little bit different. So I think you'll get a lot out of it, actually. The Art of Human Care, I think, is a really awesome book just for healing in general and thinking about integration, and if you're doing any sort of work with people, caregiver. And the information in this book, I think, is wonderful, kind of like a holistic approach to healing and wellness. And just really interesting to get Dr. Tetteh's opinion and thoughts on psychedelics, not doing any research in this field. Really fun to just chat with him to hear about any of his speculations and interests, and also how his near-death experience has informed his clinical work as a surgeon and doing surgery. Just that's a really interesting perspective of maybe being on the table as you have a near-death experience, and then on the other side, actually being a surgeon. So we had a really interesting conversation, and I think you will love this episode. If you are a student, you're just psychedelically curious about how to get involved in the field, in your education, and you're just at the beginning really trying to navigate how to start your journey here, we're offering a 5-week online class called Navigating Psychedelics for students and the psychedelic curious. We'll go over how to navigate psychedelic research and education, how to get started, maybe some career opportunities that you could get engaged in and pursue. This class starts on March 2nd. That's a Tuesday, and it will run on Tuesdays starting at 7 p.m. Eastern Time and 4 p.m. Pacific Time. You can go over to psychedeliceducationcenter.com to learn more. We're really excited about this. We do get a lot of students reaching out, so we just thought being able to put together a class for you, if you're a student or you're just really curious on how to get involved, this class will be for you. We also have our Navigating Psychedelics for Clinicians and Therapists course open for our March dates. And again, these classes run on Thursdays, starting March 11th. 2 groups. Group 1 starts at 2 p.m. Eastern Time. Group 2 starts at 7 p.m. Eastern Time. Again, you can check all of our classes out at psychedelicEducationCenter.com, and be sure to check that out. We also have a neuroscience webinar class coming up called Mind Bending, Mind Mending. It's a series on the neuroscience of psychedelics, and that is launching February 22nd. That's a Monday at 7:30 p.m. And that will just be a one-time webinar, and you can learn more at psychedelicstoday.com and go to online courses, and you can find the link there. And I think that's about it. If you love what we're doing over here at Psychedelics Today, be sure to give us a follow and on our social media accounts, and subscribe to our podcast on Stitcher, iTunes, Spotify, wherever you listen to podcasts. Greatly appreciate it. And if you're feeling called to, leave us a review. That helps us out a whole bunch. And if you want to donate monthly to the cause here and to help keep the lights on, you can check us out at patreon.com/psychedelics today and leave a monthly donation. And I think that's it, everybody. I hope you enjoy this episode with Dr. Hassan Tetteh, and we'll catch you on the other side. All right, welcome back, everybody, to Psychedelics Today. Today, I have the pleasure of chatting with Dr. Hassan Tetteh. Really excited to chat with you today.
Oh, it's an absolute pleasure to be with you, Kyle. Thank you so much.
Yeah, so could you give our listeners a little bit of background about some of your work and what you do?
Sure. So I'm a physician. I happen to be a thoracic surgeon. Grew up in a little town in New York called Brooklyn, and some people have heard of it. And I'm fortunate to have had quite a number of experiences in my career, including a near-death experience that occurred when I was an undergrad, well before I became a doctor, that I really think informed the way I practice healthcare today. And over the years, I've had an opportunity to write a couple books, and one recently is called The Art of Human Care. And really, pretty proud to share that with everyone. And have always been a fan of all aspects of healthcare, and recognize that, health and the way that we deliver healthcare over the ages in terms of humans' existence has definitely been different and has varied over the years. And so I'm one that likes to be a pupil, and one that takes into account all those things, because I think people have used over the centuries the things that work well for them.
Yeah. It's a really beautiful book, and I'm sure we'll chat more about it. But we originally got connected. So for our listeners, you're not really in the psychedelic space, but have an interest in it. But a PR person reached out and said, you had this near-death experience, and maybe we could have a nice chat about that and some of the transpersonal stuff. So I'd love to hear, if you're open to it, about sharing kind of where your journey started here, and with your near-death experience, and how that's really influenced your life and impacted it.
Oh, sure. Absolutely, Kyle. So I was in undergrad, and I was a junior in college. So just a young adolescent, so-called invincible. And I just had this great opportunity to travel to Baltimore, of all places, to interview for medical school as an early decision program at Johns Hopkins. And I was super excited, because if I would have got accepted, it would have meant that I had a pretty nice senior year, and not having to worry about, applying to med school and taking care of all that stuff. So I was super excited, went down there, had what I thought was a great interview. I came back, and a few days later, I was becoming very sick, almost like a flu, but with a massive headache, lots of fever, chills. I went to the infirmary. They uncharacteristically misdiagnosed me with a stomach flu, gave me some penicillin tablets, and sent me off to my dorm room. And this was the days before cell phones and things like that. So I was kind of holed up in my dorm room all by myself. I was a resident assistant, so I didn't have a roommate. And fortunately, my fraternity brothers, who were looking at me, trying to find me that evening, looking for me, thought I was trying to get out of work, because we had a social event that we were planning that weekend, and they came into my dorm room and basically found me, almost unconscious, unresponsive. So it took me to the emergency room in a small college town of where I went to school in Plattsburgh, New York. And so you can imagine these two, college kids bringing in me, and I was sort of unresponsive and out of it, in a college town on a Friday evening. So, the ER doc there could have thought, well, this is just another case of someone that, took something or was drinking too much. And at the time I wasn't drinking anything and taking anything. And my friends who were insisted that, something was really wrong with him, I think impressed upon them to sort of take another look. And thankfully they did. It turns out that I was diagnosed with bacterial meningitis. And so any of your listeners know bacterial meningitis and any age group, and certainly when you're young or when you're very old, can be very lethal. And in fact, there's a number of college students and college age, individuals that pass away every year from meningitis. So they proceeded to, kind of admit me to the hospital. I spent several weeks in the hospital, a couple of weeks in the ICU with a tube in every orifice of my body. I sort of light, so to speak. I remember at one point, and not really remembering a lot of what happened to me, just kind of like moments of in and out and the bright lights and all of that. But really recognizing and appreciating, sort of as I emerged from all of that I was really lucky and fortunate to survive. And when I was just days before being discharged, I recognized how bad it was. I had it because the doctor that admitted me to the ER came up to visit me, and he said, "Hey, I heard you wanted to be a doctor. I wanted to show you what you had." And I started to read about it, and I was smart enough to know I had something really bad at that point, but I wasn't smart enough to be a doctor and understand everything that it took to kind of get me through that. And so having had that experience of not only almost dying, but also feeling how vulnerable it was to be a patient and, being helpless and sort of in this isolation bubble, not being able to do anything, not even able to breathe on my own. And it was pretty bad. And it was something that left this indelible mark on me, but it also, I think, engendered this attitude and sort of this empathy that I've always had for taking care of my patients now that I've, sort of been in practice now for many years. I should add, which is sort of like the big cherry on top of this whole story, is that I didn't get accepted to Hopkins. They summarily rejected me, a big fat rejection letter after I did get out of the hospital. But through that whole time, I think one of the things that kept me alive, and I think maybe this is perhaps one of the key aspects of this entire experience, is that there was something that I think I was wanting to and trying to live for. And that in my mind was to be a doctor and to get through this ordeal, not knowing entirely what it was that I had, but kind of appreciating and understanding, despite everything, I really had this will to live because I wanted to be a doctor. And I think that is what really kept me alive. And so that purpose of wanting to do something, I think has really resonated with me. So beyond the empathy, I've always tried to find and seek out what an individual's purpose is, particularly with the patients that I take care of, because I think that has a dramatic impact on their will to overcome any one of the ailments that they may be dealing with that I'm helping to take care of.
Yeah. As I was reading through your book and you're describing like being a patient, just having things done to you and just even kind of, being pushed in the lights, it had me kind of flash back to my own experience with a near-death experience with rupturing my spleen. And I remember just getting pushed, to the ER and the lights are passing over me and the doctors are like ripping everything off of me, cutting my clothes and just being completely helpless. And all this stuff is going on around me and just kind of, having this outer body experience. And I wonder, with your experience, did you have any sort of transpersonal experience, outer body experience? Like, what was going through your mind when all this was happening?
Yeah, I will say there were moments in time, and I try and reflect back on that time. I mean, to me, it feels like I could relive the moment. It kind of was like it was yesterday. Like I remember this moment in time when this very big burly nurse was like rubbing my sternum. Now I know what that is now. It's called a sternal rub, and it's actually a mechanism to kind of keep people aroused, especially when they're obtunded and they may be not able to protect their airway. So I remember that. I remember like being in the fetal position and someone saying, "Don't move, we're going to stick a needle in your back." And now I remember what that is for. That was for a lumbar puncture to get the spinal fluid out so they could actually test and confirm that I had this. But this out-of-body experience that you're describing, to me, the entire time very much felt very surreal. And it was not until many, many years later that I started to feel, maybe experiencing it sort of again real time in another way. And that way it was in meditation. So I happen to meditate. I do transcendental meditation. And I started to practice that, TM, about almost a decade ago. I went on a very challenging deployment. And when I came back from my deployment, I was definitely suffering from some post-trauma, and I was trying to prevent it from becoming a traumatic stress disorder, but it was definitely a post-traumatic experience. And I found that TM and that method of sort of relaxation and sort of transcending above, sort of the place where you're at right now, and just really relaxing and calming the mind and quieting the thoughts helped me to really reconcile a lot of the stress that I was dealing with coming back. And it helped, not only enhance, I think, some of my creativity, but also sort of my awareness of the now and the present. And so that experience, at times when I'm in a good state, I do feel that sort of out of body experience, which is really quieting, is very calming, is very relaxing. And it, like I said, it certainly helped me through that time and that period in my life. And I've continued to practice ever since. So it's been something that I think has been a cornerstone of recovery. And now I would like to say, improving and sort of contributing in a very meaningful way to my life now.
Yeah. And I guess like after you got out of the hospital, did you notice, any changes maybe in your personality or interest, this whole process of integration? I wonder if you really had to like go through that post-hospital experience where it's like, whoa, what just happened? And it sounds like, there was a sense of purpose and maybe meaning making during this experience. And I wonder, were there any challenges during that time, and how did you really navigate those waters?
Yeah, I think that's a great question. I would say absolutely. Fundamentally, there was definitely a sort of awareness that what just happened to me was like really profound. Like, I think I could have died, and then especially when I read about like, oh my gosh, like not many people survive this, and to have been initially not diagnosed with the right condition and not, immediately given the right therapy, which I didn't get, put me in even further risk for potentially not making it. But what I did emerge from that, what emerged from that experience, and how I think I emerged from that experience, and sort of look at it now, even looking back, and how I think it impacted me moving forward, was this deep sense of gratitude and appreciation for the now and the here. And I think, I was. I was very reminiscent, and at times I've told this to my colleagues. I said, I think everyone in healthcare should have an experience where they feel like they almost die, or as part of their educational experience, because sometimes it takes that empathy to really identify and relate to some of the patients that you're taking care of. But more importantly, I think gives you this real deep sense, as I experienced, and as I compared notes with others that have had similar experiences, with this deep sense of gratitude and this longing desire to ask yourself always, like, why did that happen? Like, that happened for a reason. I'd like to think it happened for a reason. I don't think it was just some random act. And that reason there must be still something left for you to do here on earth right now. And that is such a powerful driver, and it has been, in my life ever since then. That, to your point, every single engagement, every single relationship that I have, every single sort of new adventure that I think I take it on with this sense of urgency, because I feel like, hey, you know what? Tomorrow is not guaranteed to anyone. Yeah. And not only that, if I would be gone, would I have had some regret, And I will say that my current work right now in my practice of thoracic surgery, and more specifically heart and lung transplant, and I write about this in my book, gives me this sort of reinforcing reminder of how fragile life is on an daily basis. Because in every case, I'm dealing with this sort of life and death dichotomy, right? There's a patient that becomes a donor, and it's simply because of some tragic event that usually happens to a young person, oftentimes unexpectedly, right? And then there's a patient that's in dire need of a heart or a lung. And in that sort of, continuum, I'm in the middle of that, recovering the organ and then, transplanting it and helping to transplant it into the recipient. And so there's this daily reminder, because every time I feel like, wow, that's the worst story I ever heard, and like, how someone succumbed, I'll hear another one. And it just, again, reminds me, like, every one of these patients have very similar things in common. most often they left or started the day thinking everything was going to be okay, right? And then something happened. And even if it was something that they, in fact, inflicted on themselves with the suicide, which, unfortunately, I've seen a lot of those, you have to think that, people that were with them, their loved ones, even their friends, probably saw them the day before and now are just so surprised that this happened, because you never know what state of mind that person was in. But nonetheless, it's these tragic events that sort of remind me on a daily basis, again, how fragile life is and how you have to live in the moment as much as you possibly can. And when you do live in the moment, make the best and maximize each and every minute of that moment, because you never know what's going to happen the next day.
Yeah, it's so easy to just daydream about the future, just really dwell on the past. And I mean, that's something I think my experience taught me too. And, it's a daily practice, right? Like, how do we just stay in the moment? And, just what you said, you could start off your day thinking everything's fine. And then all of a sudden stuff can change like that. Just even thinking about my own experience of like, oh, I'm going to go snowboarding today, and boom, probably I'm lucky enough, I was able to wake up after that experience. But yeah, things can just shift so quickly each moment. So it's a really great reminder for us all to kind of, how do we just stay in the moment, stay in the present at times. But that must be like a really interesting experience for you to, be traditionally trained surgeon, and to have this this experience with death and then see it every day. And I wonder, how do you show up? Are there points where you have to kind of put up these walls and be like, okay, I can't practice too much empathy with this patient? Because I mean, I'm sure surgery, you kind of have to do that, right? Kind of remove yourself a little bit, because I could imagine being too empathetic. That could probably be really overwhelming in the middle of a surgery.
Right. No, that's a great question. I will attribute, the coping mechanism to the question you asked, to, again, meditation. It really does help. It helps to, give the appropriate distance, but yet give the appropriate presence to understand the gravity of the situation. Like, wow, I'm involved in this very delicate balance of life and death, where tragically someone has passed away. Now they're they're brain dead. Now they're an organ donor. Their family's trying to reconcile this loss, and now I'll be involved with my team in this really great miracle of life in some ways for this other individual. Now that's a incredibly rewarding thing, but it can also become this very daunting, emotionally draining and taxing thing. And I think meditation for me has definitely been the sort of lever to sort of moderate and temper those, very highs and lows, those variable highs and lows that, that sort of experience can definitely entail or bring tide into the psyche. But at the same time, I also know that it's important to recognize, again, sort of that going back to the presence of mind and the here and now, because as I'm thinking about, what's happened tragically to this person, I also think to myself, like, wow, there was that time when, way back when I was in that same experience, sort of the same situation where I was like, I had one foot on a banana peel and the other one in the grave, and it was in a very tenuous place. And so, I can't decompensate emotionally because I need to be present here for the moment. But at the same time, I recognize how important and how, grateful I am to have this opportunity to be part of this really important process. So it's been a really, I think interesting balance, but it's been one that I've enjoyed living in because it has just fundamentally reshaped my perspective on life for so many things, in both good and bad ways, but I like to think mostly good ways because, you take that and the experiences I've had overseas with deployments and things like that. And I sometimes think to myself, like, I know that everyone lives their own life sort of in their own individual way. But then there's some things that, some people can get really bent out of shape about. And I think to myself, wow, this is really a big problem in your world and in the context of your, sort of present life right now. But sometimes when you look at it in the totality of everything else that you've seen, you can say, okay, I can put this in the appropriate perspective. And that helps me because, like many others, I've faced all kinds of challenges and continue to do so, particularly now in this time of pandemic and this, global disaster that we're sort of all living through. I've had lost loved ones and things like that. And again, it's going to bring me back to this sort of presence of mind and saying, hey, you've had all these experiences in your life. You can kind of compartmentalize where things should be in their appropriate perspective. but still at the same time kind of live in the moment and try and do the best with what you have.
Yeah, it's definitely a balance and a practice. You brought up the pandemic, and something that just kind of hit my mind was our relationship to death, culturally. I wonder, what's your relationship to death? I'm sure, obviously probably seeing it all the time and also reflecting on your own experience, and how might that be a little bit different to like the cultural view on death? And why do you think culturally we kind of try to ignore it or push it away? And, does that, feed into some of the issues we have on a societal level?
Yeah, well, that's a really heavy question. So
sorry,
but what I may do is I'll start by answering with a way to maybe bring a little levity to the question, and I'll never forget this because it was something that resonated with me, and because you so aptly said we have a cultural sort of perspective on death, particularly in the States here. It reminds me immediately of a conversation I had with one of my colleagues from the UK. So when I deployed, we were with a multinational force. So we had folks from UK, Austria, and we would, just like we do when you're all deployed, you live together, you eat together, you work together. And in this case, these were the medical professionals that we were all taking care of the wounded warriors out there. And it was a group of health professionals from the UK who were having this philosophical conversation on death, actually. And he came out, this one person, one of the officers came out and said, the problem with you Americans is, and he paused and we were all like leaning in. We're like, what? He said, you all think that death is optional. And immediately, right, it sounded in one way, I think he summed up like, sometimes some of our problems and challenges with how we look at death, particularly in our society, because Americans are, so forward thinking and always looking into the future. And so, death is kind of like, some inconvenient thing that may happen or maybe not. We'd like to not have it happen. But when you hear someone say, you Americans think that death is optional, it makes you pause and think, wait a minute, they have a society that is a little bit different in terms of like how they look at and approach that very natural part of life, right? There's a beginning, there's a middle, and there's an end. But, sometimes we don't think about the end so much in our own lives. And it really started to engender in me like this, this real thought about, really fundamentally, how do we think about death? Now, I like to think in my life that, there is the physical and the sort of scientific aspect of death, right? Yeah, biologically, you're going to die, and that'll be the end of the body to some extent. But I like to sort of think a little bit more above that and kind of, transcend that thought and say, well, if you think about the energy that we have in our bodies, right? You can't destroy energy. So yes, I may not have my physical form anymore, but that energy has to go somewhere. At least I like to think that. Mm-hmm. So there's that, right? And then there's my own spirituality. I was born and kind of raised into, the Christian and Catholic faith. So I have that sort of feeling that yes, there is life after death. And that's just something that I just have spiritually. Then I take all of that and I think about, from the cultural context, how do we approach this? And I had a very amazing experience not too long ago by having a conversation that was sort of orchestrated with this organization. Actually, it was a TED Med conference. I know many people are familiar with TED Talk. So there was a TED Med conference and was one of the best conferences I ever went to. And in that conference, they organized something called Death Over Dinner.
Oh, yeah, I've heard about that.
I don't know if you've ever heard of it. It's this fascinating, experience where you sign up, to be a volunteer to basically do that. You talk about death over dinner. Now, the fundamentally unique thing about it is you have this conversation with perfect strangers, like intentionally it's perfect strangers. So they randomly assign you to have dinner and you go, it was a nice restaurant, you go sit down and it's kind of a private setting, semi-private setting with these people you've never met before. And you're sitting down there and you have like 12 people around the table. You don't know who anyone is and you're having dinner, but the topic of discussion is death. And it was really facilitated by a volunteer. And Kyle, it was one of the most impactful experiences I've ever had, emotionally charged and so transformational, I guess is a good word. So much so that to this day, I am friends with the people, those perfect strangers
That's awesome.
that I had death over dinner experience with, and got to learn more about them than I would argue that I learned about and know about my own family members. So it started out very, very, very simply with a kind of roundtable and, introduction, and then with 3 questions that you needed to ask. And that the questions were, has anyone died in your family? Well, most people would answer yes. And then the second question was, how did that make you feel? And then the third one was sort of like, what do you want your death experience to be like? Now, on surface, they sound like, well, those are pretty simple questions to ask, right? But the uniqueness of having this intimate setting, you're really a captive audience, and you're with perfect strangers, totally opens up the emotional aperture, right? Because now you could talk about anything because these people don't know who you are.
Yeah.
And I mean, Kyle, the things that were shared and things I shared were so profound. And I really, got to appreciate, like, wow, I never really thought about my own death in a way that, forced me to kind of be on the spot now and explain to these strangers, like, what I would like my death to be and what I'd like it to be remembered as. And sort of collectively, all of these experiences that I just described kind of lead me to this kind of conclusion that I think death in its natural form is absolutely something that's going to happen, right? That's just the way where we're designed. We have a beginning, we have a middle, and we have an end. And I think it's our duty and our responsibility, in my opinion, to make your life as meaningful as possible while you're here, so that in your death, your music continues to play, so to speak, because Bob Marley to me is never going to die. I mean, I can listen to him forever. And, my children's children will listen to him forever. So, you may stop them one day and say, hey, is this guy Marley still alive? And they might be like, sure he is. I heard him yesterday. And it's like, and I think it's in that way, whether you're creating something, you're leaving something that will endure and sort of surpass you in the physical form. I think, in many ways you live forever. And I think that's the way I kind of reconciled and sort of appreciated this, because that was in part my answer to that question of, like, how do I want my death to be experienced? Well, yes, it's going to be the physical, I'm no longer here in the physical form, but I'd like to think that the memories that I helped create with others, the relationships I developed with others, the things that I did, my contributions to society are going to endure well past my, the end of my physical form.
Yeah. And thinking about that makes me think about purpose, but it also, this phrase popped in my head. I remember taking a death and dying class, and I think this is where I first heard it, but it's a death meditation I, come back to. And I think I'm one of these people that I guess kind of meditate on death daily, just because, I feel like it's on my shoulder. I don't know if it feels like that for you, but, just having that really profound experience, it's like, that's a real thing.
Right.
But the phrase was, how you live your life today is how you prepare for death, and how you prepare for death is how you live, or something along those lines. And it really gets me thinking, like, every day we are preparing for death in a sense, and how are we showing up in each day? And I just love that, how are we showing up, and even just the purpose? And I know you talk about purpose a lot in your book, and I wonder if you could speak about that. Like, how do people find purpose? And I know sometimes, it feels like a very kind of new agey thing where, talking about manifestation and, align with your life's purpose, your soul's purpose. But I think, like, to the core, I mean, that was like a really big thing for myself, coming back after having this really profound experience and feeling like there's some big purpose in life. And so, how do you approach this?
Yeah, that's an excellent question. I think it's sort of a question of the ages, right?
Right.
You can look back into ancient writing, and people are talking about this purpose and the meaning of life and why they still here. And, I think that there's some really good examples of what purpose, at least in my opinion, really, fundamentally evolves or kind of like, devolves into. And I think for me, the purpose is not something that someone sort of like says, aha, this is my epiphany. I have my purpose. I think that the purpose in one's life ultimately comes from doing something. And in that act of doing something, there's a discovery that, aha, this is my purpose. So what you're doing right now, having this forum where you can convene all these people that are thinking about, these really profound and important subjects and topics, and having guests on to share their experiences. in that way, you're doing something that is giving you a purpose. So you could say, well, my purpose is to be, or a podcast host. Well, that's not really your purpose. Your purpose is really helping people, because as people are listening to this dialogue and this exchange we're having, they're going to see a connection in their own life and say, aha, wait a minute, that happened to me. I understand what they're talking about. I get what they're saying. You know what? I want to explore that a little bit more. I want to dig into that a little bit deeper. I'm going to get a little bit more self-discovery. You're the catalyst to have that all happen. And so in many ways, you help an individual. Now, you might not say, well, my purpose when I got up this morning was to help people, but actually it was. That's what you did. And I think it's in this act of doing things that, people discover a purpose. And so I write about that in the book. And I talk about how when I see my own patients, I'll ask them, I don't come out and say, hey, what's your purpose? Because they'll look at me like, what kind of doc is this? This is a weird doctor asking me about my purpose. But I'll ask them fundamental questions like, hey, what do you enjoy doing? What do you like doing? What do you do when you spend time with your friends and your family? And in doing those asking those questions and having them tell me what they like to do, I can start to discover things that are really important and fundamentally like part of their purpose, like their makeup, their composition. This persona that's in front of me is like, hey, they really love family. Like their purpose is being like the glue that holds the family together, and they are absolutely like, illuminated when they talk about their grandchildren. So to me, I'm like, aha, that's it. So now when I'm approaching them from what do they have to do to get better after surgery? My approach is now like, hey, you got to get up out of bed and you got to get walking and you got to take these medications. And I'll say something totally different. My approach is different. My approach is like, hey, remember your grandchild you told me about? If you really want to be around to maybe watch them like march down that aisle and graduate from high school and college and maybe the med school or dental school or law school, you know what? If you really take care of yourself right now, we talked about walking and maybe losing a little weight and taking these medications that you don't really like to take. You do those things, you know what? You'll be able to fulfill your purpose, which is being there for your grandkids or being there for your family or being there for your loved one. Or if someone's really passionate about their work, I say, they're part of this nonprofit organization that they're running. This is their purpose. That's really what gives them their passion. So I tap into that and I'll say, hey, we can get you back to doing that. And even more if we get you through this surgery, because you're going to have more energy, you're going to have more stamina, you're going to be able to work longer hours and potentially contribute more. And then you'll see the light bulb go off. So it's in finding or helping the people that discover their purpose. I think it is sort of one of these great partnerships that I like to try to develop with the work that I do.
That's beautiful. And I think any patient that comes to you is just probably so blessed to have you as the doctor. I just think about, because, you do talk about, these different pillars of, human care and really how to approach this. And as I was just reading through a lot of this, just, the learn, right? So listen. And I just think sometimes even, I've had experiences going to the doctors where it's almost like, I just said this thing and they're not even listening or asking deeper questions, right?
Right.
And, I think that is really important for the healing process, right? And I don't know, I always kind of come back to like narrative. And I think purpose plays into narrative and really, really understanding where a person is. And, you even kind of point out here, in this like framework, even just the emphasis on now, like what's showing up for you now, and maybe not even looking at things that happened in the past, which I think is important. But yeah, what's showing up now and how can we find purpose and meaning in the now to really kind of speed up the healing process? Right.
Absolutely. You touched on something that's really important. We learn this, and I think, it's not often advertised as much, but, if you've been practicing for a long time, invariably you'll start to discover that, hey, no matter what your specialty is, dermatology, radiology, family practice, surgery, a lot of patients will come to seek medical attention with, a so-called complaint or an issue. And it turns out that, if you do take that time, like you said, to listen and empathize and sort of understand what their now is, you'll realize, hey, wait a minute, they're not really here for the problem that they told me about.
Right.
They're here seeking something else. And oftentimes it's an emotional type of thing, or it's a behavioral health type of thing. And it's not to say that, we should dismiss that. We're not all behavioral health professionals, but in many regards, we do need to have that attribute about us because we're all human, right? And we all have these same needs. And if you take the time to listen to some of these folks when they're kind of bringing these, surface issues to you, but then if you let the onion kind of get peeled a little bit, you'll start to realize, oh, you know what? They just needed somebody to listen to for whatever the issue is. And then, you may be able to direct them to where they may be able to get the definitive help that they need. But a lot of times patients will come to us, and if we are not aware, they don't have the situational awareness to understand what the real need is and to understand what the now is, you can simply just dismiss it like, oh, this person's just here again for their sore ankle. I'm just going to give them some pills and send them on their way. And unfortunately, it'll be a mutually unfulfilling engagement and what I call encounter. Mm-hmm. And that happens a lot. And that's why I try and differentiate, in the book and sort of in my own practice, what's the difference between like healthcare and human care? Like healthcare would be exactly what I described. Oh, you came in here with problem X. I listened to you for like 2 seconds. I gave you a script and I sent you on your way and, go deal with it. But human care would be a little bit, it may take a little bit longer, not a lot longer, but just a little bit longer to listen to what Kyle is really conveying now. Like, what is his now? Oh, okay. Turns out he's not really here for his sore ankle that he saw me about 2 weeks ago. He's here for something a little bit different. And maybe if I just take a little bit more time to listen, I can find out what that is. And maybe I can help provide the resources and the help that he needs to address that issue. And I think fundamentally, if you think about, the huge crisis that we have in behavioral health, right, in this country, and, with dependency and people using all kinds of things to sort of escape a lot of their issues, you'll probably find that it could be just a lot of people just needing a little empathy and a little bit of someone to listen to them and appreciate and understand what their problems are. And I like to think that our healthcare system is above no other in the world. And I think we do have excellent things to offer, but there are many areas where we're deficient and not doing so well. And I think that's in one of the areas is in behavioral health. And I think that does lead to a lot of the problems that we unfortunately have, especially in a time like this where you have a population that's increasingly more isolated, increasingly more challenged, and increasingly more stressed. It just is not a good recipe.
What do you think it would take to make that transition from healthcare to human care within the health system?
Yeah, well, I think I write about it in the book, so it's something I've definitely thought a lot about. I think that it will take a shift in the way that we do certain things, but it won't take a lot. I don't think we need to blow the whole thing up and rebuild it. I think what it would take is some education and some training on behalf of those that are in the healthcare space. And that's really sort of my mission. My mission is to be out there to try and teach, people about human care. And part of it is with the narrative, like you just talked about, how important and powerful narrative is. I think humans fundamentally are attracted to story and narrative, right? That is like how we communicated from the dawn of time. We talked about stories well before there was a book and Twitter and Facebook and all that stuff. People just sat around and told stories. And I think it's through my narrative that I like to think I educate, primarily those that are helping to take care of others. But my book is not, and my principle of human care is not intended for a healthcare professional, the MD or the RN. It's really for anyone that's a human that cares. And I think from that standpoint, it's a large tent. So a lot of people hopefully can find attributes in this that resonate with them. But to fundamentally address the question of like, how do you do that? It starts with, the narrative of teaching how do you listen to an individual. And I talked about, a framework of learn, like let's learn about the other person. Easy to remember. Like, yeah, I want to learn about you, Kyle. Like that should be my first step. Like before I even think about like, well, how am I going to fix this big global problem? Let me just learn about what's up with Kyle. Let me listen to him. Listening is actually a very important thing that most people don't do. Mm-hmm. And this is like you said, and they've done studies on this. In healthcare, do you know how long it takes to be interrupted when you're a patient or you're someone seeking care and you're engaging with the healthcare professional, whether it's a nurse, the person taking up your vitals, or even the doctor, how long it takes before you get interrupted? They've done studies on this. It's pretty amazing.
I don't know, 30 seconds?
Less than that,
Less
like
than that. Wow.
16 to 18 seconds, you'll be interrupted. Now,
Wow.
think about what happens when you get interrupted. You're about to tell your life story, or, you're now to this individual, and you've been waiting. You had to get an appointment. You had to wait weeks. You had to take the car, get in the car, drive. And even now, if you're just firing up the telemedicine thing, you still have to like go through some effort to be in front of this person. And you're nervous, you're scared, you're not really like sophisticated with the lingo. You don't know, but you have your issue and your problem. You want to share that with this person that's there to help. And you start talking, and within 16 seconds, you can't even get out like half of your story, not even the beginning of what's really your issue. And someone will interrupt you. And the moment you get interrupted, you think about, you've got yourself all ready to tell your story. Now you get interrupted with a question or with a qualifier. Now you're off track somewhere. And before you know it, your whole visit is over and you have not had your issue addressed. And it turns out, and I do this exercise when I kind of share this framework, is I'll tell people I'm going to give you 3 minutes to tell your life story to someone, a stepping stone story, right? It's something that has been profound or impactful in your life. Well, I'll even go back to my death over dinner example. It only took each of us like a few minutes to tell us like this really profound, life-changing experience for someone that died. How did you feel? And your own death. I mean, it took us a few minutes. We got through the whole thing. And, you can, if you give someone a minute or two, they'll tell you a lot. But you know what you have to do in that whole time? Don't interrupt them and let them just talk and listen. And when I think you do that, like that's the first step, I think that, you're able to start empathizing with them. And then you're able to empathize. And then, you're able to start, developing this sort of affinity is kind of where the A comes into. And in terms of like, what is it that is really kind of making Kyle tick here? I can kind of affinitize with what he's dealing with. I can start repeating some things that might help, with the situation. And then of course that N is like knowing what the now is. So I use this LEARN framework as a way of saying, hey, let me introduce this concept of human care to, whether you're a healthcare professional, or you're just someone who just really wants to try and help others, as a way of saying, hey, this is the first step. And the first step of the LEARN framework is to listen, like just listen. And I think listening is probably the biggest key attribute of communication. And it goes back to communication. And I'll evoke something from my military experience. When I was deployed with the Marines, one of the colonels said one time, he said, the Marines do 3 things. They move, they shoot, and they communicate. And no one on the planet does the first 2 better than a United States Marine. I'm like, I got you, Roger. You're right. Roger that. But the communication is something we sometimes get wrong. And when we don't do it well, it leads to the most problems. And I think that's true. I mean, that's true in healthcare. That's true when you're delivering human care or wanting to deliver human care. It's true in our politics. It's true with everything, your own personal, interpersonal relationships. So I think it fundamentally starts with some communication, a little education, and, providing some frameworks that can help people sort of approach this, really important work of taking care of others, sort of in a different way.
Yeah. Listening sounds so simple, yet I feel like it's a really hard thing to do. And just, even just sitting here and creating this space and listening to you, there's so many times I want to just jump in or like ask you another question. It's like, all right, how do I pull back and actually just listen to what you're sharing? And I feel like, humans do. We always want to try to connect and jump in and maybe interrupt the conversation at times. So I want to make a little bit of a transition here, just so we touch on the topic of psychedelics. And, I just even think about, I guess I have multiple things going on in my head right now. Let me ask you, I guess we'll start off with the question of how did you get interested in psychedelics? And I know I think you said you didn't have any experience with it. So, as a, medically trained person, traditionally trained, what's really kind of piquing your interest here? And is it kind of like a paradigm shift to really think about using these medicines in a way that might be different from, maybe how traditional medicine works?
Right. I'll say that my experience with it is both kind of like academic and experiential through others, kind of living vicariously through others. So my interest in it really fundamentally comes from being a student and a pupil of health over the ages. And like I said, healthcare. So there's a story I share of like going way back in time, 399 BC to like, the time of Hippocrates. And I share this story about how doctors took care of people back then. If you think about it, I mean, that was well before MRIs and, all these fancy medications we have and compounding medication. And you look at, the kind of across the spectrum of like humankind and human existence, we have always had shamans, healers, whatever you want to call them, in the world, right, that have taken care of people. And in some societies, people have lived into octogenarians and become, it was routine for people to live until 100 years old. This is before, what we call modern medicine existed. So you have to think to yourself, like, how did that happen? And it's fascinating to me because it was, a book like Blue Zone, for example, you look about the kind of foods that people eat and just the way that they live, they're able to live and sort of deal with illness in a way that relies on, herbs and different things that we would consider non-traditional medicinal, substances, but yet they're able to thrive on these things. So it's always been impressed upon me that, we don't have the monopoly on the best healthcare because no, that's been done. It's been done for ages, well before, we came into existence. So there's that aspect of it. But as I think I mentioned to you before, before our meeting, one of my very good friends who's an ER doctor has, he has a lot of experience, but personally and professionally with psychedelics. And he's told me that, he's been able to not only see a big difference in the patients that he's taking care of, but also in his own, sort of experience with his, with his own personal use. And I'm like, wow, this is pretty amazing. And I, like I mentioned to you, I was serendipitously, connected with my artist for my book who happened to, do a book, actually entirely dedicated to psychedelics. It was a psychedelic coloring book. And she has lots of experience with it. But, I could tell from the conversations I had with her and, sort of my own sort of background and research and my own experience with my own colleagues that there is this manifestation of a lot of creativity, a lot of inner peace, and quite frankly, a lot of good treatment that comes from, the judicious use of different psychedelics. So from that standpoint, it totally interests me and like it's fascinating because I'm all for helping individuals find what works for them because everyone is different and everyone is not going to react the same way to different treatments. And I'm just not, egotistical or so omniscient that I know it all. And I can say, well, no, this way has to be the best because I've seen so much in my own life and in my own career. And I, have friends and folks that I really respect that have had different experiences with this. So I've kept an open mind.
Yeah. And I guess, like your colleagues, are they interested at all? Like, I wonder, like, what in the circle of like medicine, are people starting to really wake up to like, there's potential here?
Oh yeah. I think I'm starting to see an evolution. I think we all are, right? We're starting to see an evolution. I mean, if you just take, not from a, purely psychedelic standpoint, but you just take something like cannabis, for example. I mean, that's like now, so much more acceptable, right? And so many more people are using it for not only medical conditions, but they're able to sort of say, hey, there's a lot of different conditions that this could be potentially useful in. And so you're starting to see a societal shift, right? Whereas before it was like, no, this is terrible. We can't do this. Or, criminalize it. You're seeing a lot of, acceptance. And again, I'm a pupil of sort of history. And I like to read about things and learn about how, different aspects of, things that get introduced into the health world or, medicine sort of kind of evolve and come to be. There's lots of research that has been done on psychedelics. I mean, decades and decades worth of it and a lot of good research and some things that I think have informed some of our practices today in terms of how we take care of people. So you can't discount any of that and you just have to just, be aware of it and understand it. So I think the answer to your question is yes. I think there is an evolution of thought. And I think that, as time goes on, because there's so much more availability of information and people can access a lot more information now than they could ever before. Yeah. And there's a connection with communities and individuals that would have never been able to get connected, through social platforms. Now they can start sharing these experiences and have like this sort of vicarious learning with the community. So I think all of those things will accelerate, sort of the adoption. I think the evolution of psychedelics for sure. And I think of people's understanding and potentially acceptance of everything.
Yeah. And I guess like thinking maybe like a few years back before you ran into psychedelics, did that stigma of psychedelics ever like hit you going, oh no, like those are dangerous?
Oh yeah, absolutely. Yeah. Especially in like traditional modern healthcare. Yeah. Like, if you'd have brought something like that up in the classroom, you'd probably, they'd probably refer you to the dean for some scolding and redirection or something.
Right. And so the shift for you is really kind of seeing the academic literature and hearing some colleagues talk about their positive experiences.
It is. I think it's definitely coming from that. And I think, again, like I said, the availability and probably the ubiquitousness of the information that's out there, I think is naturally making it, say, okay, let's take a second look at this. Let's understand a little bit better. And of course, it's undeniable, like the social platforms and platforms like yours. I mean, all of your listeners and the people that are experiencing it at different levels are coming together and engaging with each other, right? And sharing that kind of knowledge and sometimes not common knowledge that I think is informing a lot more of a population as to, what the attributes and some of the benefits and pros and cons of psychedelics are.
Yeah. And, when we were on the topic of this idea of human care, something that kind of popped in my head just thinking about psychedelics was, I think this could also shift the way psychiatry works, right? Like you're talking about, just prescribe, you have this symptom, we'll maybe give you a medication. Really thinking about how psychedelic psychotherapy works is sitting with a client, right? For maybe hours versus sitting with them for 15 minutes or an hour and just getting little bits of information and maybe prescribing just a kind of a Band-Aid medicine at times, which is helpful for some people. I mean, some people do really well with that. But I mean, I feel like it will really kind of revolutionize the way we care for people in a sense of, thinking about just thinking about the MDMA trials and thinking, when does somebody sit with you for like 6 to 8 hours and listen to your experience unfold and how healing that could be just to have somebody sit with you during a really intense time like that.
Right. And, to your point, this is where I think my colleague sort of gave me this sort of epiphany in some ways, because he was describing exactly that. He said, during this experience, he was with an individual that was really spending a lot of time with him. And I was like, wow, wait a minute, you sat down with someone for like, that long? And like, that's incredible, and then they sort of tailored everything to what his needs were, and I was like, oh, that's pretty unique. It's kind of like what you think you would expect healthcare, but you don't necessarily get that.
Right.
So.
Yeah, I think one of the downsides and I think one of the challenges is just going to be the resources for that type of therapy to be able to really create that container. And I guess we'll see how it unfolds as FDA process unfolds and these medicines hopefully become more acceptable. But I think there's different models out there, from the medical route to, say, the spiritual and kind of self-discovery route, where maybe you're not doing it within a Western medical framework.
Sure. Yeah.
Yeah. What excites you the most about psychedelics? Like reading and hearing stories from it.
Well, I think it's the discovery and perhaps the potential of what it may bring to bear in terms of like therapeutics for people in need. Like you said, I think again, if anything, I think in the behavioral health world, there's just so much room for improvement and for doing things better. And if psychedelics are a component or an aspect of that may help attempt to potentially address a very serious need, then I think that that's worth exploring and discovering and unpacking a little bit. So I think that's what excites me, because I think that fundamentally, I think all of us in healthcare want to do what's rooted in some science and based in fact and what works to help our patients and to help those that are in need. And I think that, how that comes about, you have to be interested in that, and you have to see how that evolves, and you want to see that, be successful. I think so. I think in that case, in that regard, and sort of in that context, that's what really excites me. I think we're learning all the time about things that, are actually impactful and actually work, right? And again, I think that rate of discovery is much faster now than it had been in any other time.
Yeah.
And I think because you have so much more robust social networks, there's a little bit of an opportunity to eliminate some stigma, because you can start to see, hey, wait a minute, this worked for some people, and they have, I think, a pretty good body of experience and knowledge, as well as sort of experience behind this, that can say, hey, this might not be what we thought it was, and we can take a different look at it. And I think that's going to be fundamentally true with a lot of things, moving forward in healthcare and beyond.
Yeah. So, psychedelics are kind of hitting mainstream media outlets, and people are really starting to learn about this. And, a common thing, we will get emails saying, hey, like, I went to my doctor, told them I have an interest in this, and they don't want to hear about it. Being a physician and surgeon and in that traditional world, like, what would it take you for like the client to come and say, hey, I'm interested in this? Like, how could maybe the client help educate, their doctor, maybe help to provide some sort of detail? Like, how would a client approach somebody that's maybe a little bit more resistant to that in that traditional worldview?
Yeah, I think that's a good question. I think, I'll use the meditation example as a way to answer the question. So I think, fundamentally, when we're trained in sort of Western medicine, unless you've had some like experiences like I talked about, near-death experience, you've just been a pupil of learning about, other kinds of ways to treat people, you're not really going to be necessarily exposed to a lot of things that are outside of the mainstream or outside of the sort of body of knowledge. But again, if there's a way for the community, and for example, the case that you mentioned, well, hey, I'm a patient, I'm bringing this question to my physician, my healthcare professional. One, you'd like to try and go to a healthcare professional that's going to listen to you, kind of going all the way back, to give you the space to sort of like share what your thoughts are. And if they're a good healthcare professional, I think what they'll do is say, hey, let me look into this a little bit more. Let me learn a little bit more about it myself and understand it. And to that extent, then you're going to start to hopefully see some people within the sort of mainstream medicine, community say, hey, let's look at this and compare it in a more, in the kind of the traditional ways that we look at everything else, right? Because all of these medications that we're using, that you have in a formulary, they're being created through different agents, they're chemicals, they're herbs, they're different things that are all coming together to create a medicine that has side effects, that has an impact, that has a sort of a toxicity, and that has a profile. So I think it'll take, for more widespread adoption, to have some of these therapies within the psychedelic world to sort of have that same sort of process ascribed to it, the trials and the clinical trials and things like that. And I don't think that that's out of the realm of possibility, because again, if you look at, what's happening in sort of the evolution of lots of other things that, were one time considered, well, no, we're never even going to consider this, but are now like more mainstream, you start to understand, okay, we see that this is happening and this is coming to fruition. So in meditation, again, like using that as a concrete example, in TM in particular, there are a lot of studies now that are showing that when you do, incorporate TM as a means of therapy, whether it be for high blood pressure, for example, or treating post-traumatic stress disorder, you actually can see when you take the, folks that are not having anything like a placebo and, you introduce the practice of TM, you could actually lower blood pressure, or you have patients have a less requirement for blood pressure medication. You can see have a real impact on patients that are suffering from post-traumatic stress disorder, that have taken all kinds of medications and have had serious, terrible side effects. And then you introduce them to TM, and now over time, not only don't they need medication, but they're actually able to function, they're able to sleep better, and they are experiencing, a level of peace and calm that they never experienced before. And you hear those stories. And so when that starts to happen, it becomes like this undeniable cycle that says, well, right, there's proof, but I also see it. I can see it with my own eyes. And I understand it. And then I'll just end with this last anecdote. My friend and my colleague that I told you about, he has, not only helped his patients, explore, therapies within psychedelics, but he's used it personally, and he understands, oh, I see, I understand. And now he has his own experience with that. So I think it'll be a combination of all of those things that sort of help to, bring about a difference in terms of opinion and acceptability and change. And of course, all the stuff that you're doing, right? Having this platform right now, having people talk about it and learn and explore, what the attributes are and what the pros and the cons are.
Yeah. Yeah, thank you. So I see that we're coming up on an hour. So I want to just toss it out there. If there's anything that you want to, chat about just really briefly, if we didn't touch on an important aspect of your book or just your work, if there's anything you just want to wrap up here with.
Sure. The book to me was really a manifesto of sorts to really help people to appreciate and understand what human care is all about, and the difference between fundamentally what human care is and sort of what the traditional healthcare is, and sort of my quest to sort of make things better for those that are in need. And again, the three principles we touched upon, one of them in particular is purpose, personalization, and partnerships. And I think with those three sort of elements of purpose, personalization, and partnerships, you really embody and sort of characterize, what I believe is human care and what it's all about. And I think it fundamentally makes a big difference in the way that people receive care and the impact it will have on their life.
Awesome. And can people find you online anywhere? And where can they find the book?
Yeah, absolutely. So the book's available online and through my website. It's on Amazon. It's The Art of Human Care. It has pictures and beautiful pictures. And
it's a beautiful design.
Oh, thank you. And my daughter, illustrated many of the images in it, as well as some other really talented artists. So I'm very proud of that. And again, it's available online and on Amazon. And then you can find me at drtetteh.com. So DOCTOR, and then my last name, TETTEH. My Twitter handle is the same moniker, and I like to post things there, and same on Facebook as well.
Awesome. Well, Dr. Tetteh, this has been a wonderful conversation. Really enjoyed it. So yeah, thanks so much for your time.
Oh, thank you, Kyle. I appreciate the opportunity and the experience of being able to share some thoughts with your audience.
All right, welcome back, everybody. I hope you enjoyed that episode with Dr. Hassan Tetteh. I know I really enjoyed talking with Dr. Tetteh and just exploring the near-death experience and his book, The Art of Human Care. I would definitely check it out. It was a really great read and short, really beautiful artwork in there. And as he mentioned, ironically, and I guess a fun little synchronicity, was the art was done by somebody who also did a trip journal. So yeah, definitely check it out. You can check out more of Dr. Tetteh's work at drtetteh.com. And that's doctor spelled out, www.doctortetteh.com. Yeah, if you have any questions, comments, and thoughts about the show, you can send us an email at psychedelicstoday@gmail.com. Yeah, feel free to send us an email about any thoughts. And be sure to follow us on our social media sites, Facebook, Twitter, Instagram, and leave us a review on iTunes if you're feeling called to it. So thanks again, everybody. I hope everybody is staying well and safe and healthy. And we will catch you on the next episode of Psychedelics Today.